Thank you. My name is Albert. Nice to meet you all. I'm a physician and co-founder of Augmentex. And I'll moderate the panel a little bit. Why don't we spend 2 minutes each about who we are, what opportunity we saw in healthcare for AR, and what's exciting us most. And perhaps we could start from one end and just go.
Sure. My name is Ansinn. I'm founder and president of Brick Simple. We're a development studio with offices in Boston, San Francisco, and Philadelphia. We've been making great use of augmented reality in education and training for healthcare. We've been working with the University of Pennsylvania School of Medicine, particularly their Center for Resuscitation Science, doing CPR and virtual reality. Also working with Children's Hospital of Philadelphia with now a spun-out organization that is using augmented reality in the operating room. And we're proud to be working with these technologies and sharing some of our experiences here today, both on the panel and also during a talk that I'm doing tomorrow. Thank you.
Hi, my name is Shirin Sadri. I'm a second-year medical student at Columbia, and I'm working with Gabby, who's a fourth-year medical student in the lab of Professor Stephen Feiner, who you heard speak earlier. And we're together working to create an augmented reality guidance system for vascular interventions, which is a type of minimally invasive surgery.
And as I said, my name's Albert. Augmentex is an early-stage startup software company that is building a AR platform for rehabilitation therapy for neurologically impaired patients. And we're looking into leveraging the visual, cognitive, and all the neuroscience you heard about this morning of AR and using that as a tool for therapy. Perhaps we can, next we can talk about, it's great because you're working on education and you guys are working on a system that displays information so that enables clinicians. And I'm trying, at Augmentex, we're trying to use that as a therapy. So it's like different kind of areas in healthcare that we're working on utilizing AR. Perhaps we can talk about some of the challenges of making this technology stick. Because as much as the smartphone industry brought the wow factor to the healthcare industry, I'm still using a pager. So it's sometimes hard to bring changes in healthcare and make that technology work long term. Perhaps we can talk about education and in procedures, ORs, and I can talk about the therapy.
Sure. I mean, I think one of the great opportunities that exists with augmented reality is we've done a lot of work also using virtual reality in healthcare circumstances. And this challenge of haptics, like can you feel something that's there? And we've integrated mannequins into experiences, did all those pieces, but it lacks the kind of feedback you have when you're actually there and immersed in it. And I think augmented reality that provides that augmentation on the world's great benefit. But I think part of the challenge, and Stephen Feiner hit upon this in his presentation as well, is that designing these experiences is hard. I think if you take and try to adapt something that you're doing on a desktop or point and click and a mouse, it's not useful to bring those user interface conventions to augmented reality. If I'm having to go and tap buttons in the air and do those kinds of things, I really want something that is driven by the context of the task that I'm performing, be something that is seamless, that truly, instead of giving me something to distract me from what I'm doing, particularly if you're in the operating room or if you're in a life and death situation, performing CPR, for example, you want something that gives you those feedback, gives you information that's actionable without having to be point and clicking in space. And I think part of the opportunity that exists with augmented reality is if you look at all of these experiences where you're on, whether you're on a phone or your laptop or computer, is that you're taking your hands, you're taking your eyes and directing them away from the task, where with augmented reality, we can bring the hands and eyes to the task. I think good experience design recognizes that.
Yeah, I completely agree. I think a big part of specifically integrating into the OR is making sure that you can integrate smoothly into the workflow that's already in place. So in our case, we're really trying to emphasize the input that we get from doctors in our UI design. So we get their opinions and feedback based on after they test our system, and then we take that to the lab and integrate that into our system so we can integrate as smoothly as possible. For example, as you can imagine, physicians are using their hands for pretty much the entire procedure. So one aspect of our UI is to integrate a hands-free approach into manipulating some of the virtual content. So that's an example of how we're really trying to emphasize integrating smoothly.
In healthcare, it's a big challenge that you have to prove whatever you build is valuable to the end users, whether it be patients, physicians, or nurses and other mid-level providers. And the three common questions I got from my experience so far has been, number one, does it work? Number two, is it better than what we use? Which both of them are looking at kind of like the clinical outcomes. And then the third question always comes to how much does it cost? So in a way, like in order to prove value, what I have learned is that you first have to show there's outcomes that people care about in that particular scenario or condition, and the cost has to be reasonable. And if you can, ideally, if you can increase the outcomes, achieve better outcomes while decreasing costs, it's ideal, but oftentimes it's very challenging to achieve both. So usually being able to achieve one is probably a good enough challenge from the therapy stuff that we do. Because in stroke, people ask, how does this impact the patient's outcome? And then, is this going to add time to my work, or is this going to be more expensive than what we use today, are the common questions we get. And what's funny is, like, depending on the scenario, the way you quantify that is very different. And is there a way to try to kind of a framework that you can build to try to figure out whether your product is adding value or not? How have you been measuring that? How have you been measuring your impact?
I think healthcare is gloriously challenging in this way because there's lots of things that you can spitball ideas on delivering burritos through UAVs and all that kind of thing. But the challenge in healthcare is that the value of dollars and pieces, you can't forget the science behind it. So like work we've done with the Center for Resuscitation Science with Mary and Larry, we've done work that's part of published studies to show, okay, yes, this is not just marketing ease, that this works well. Here's a study, here's a group, here's the science behind it. And as a technologist, it's easy to become frustrated by that because you wonder, why isn't this moving as quickly? But the reality is that science is important, and of course, in the United States, the regulatory aspects that we deal with here, you have to do those things, whether you're dealing with something that becomes a medical device, whether you're dealing with something that has to be sterilized, how is this hardware managed in the environment? And we look at that as kind of the great fun challenge of it. And the general rule of thumb that if it was easy, everybody would be doing it. And it can be very difficult and frustrating when you're trying to innovate in this space because you don't have that raw velocity of those pure consumer use cases. It requires some cleverness. It requires understanding of what's needed from a compliance regulatory aspect. And from our experience, as you've gone through all those hurdles, the what it costs matters less. And I think when people talk about how much something actually costs, it's the value that you get from it, whether it's the efficacy, it's reducing risk of infection, all these other steps that can come into play, which suddenly make something that seems very expensive quite inexpensive when it comes to the impact to these institutions.
So for our particular use case, we're targeting vascular interventions. And so to be used intraoperatively, there's not that much of a cost consideration because it's just a couple $1,000 for an augmented reality headset, which is less than the cost of just one procedure. So one-time purchase. It's not really a major factor. The bigger thing is proving value and not interfering with the procedure workflow. They're all very into their routines. They do the same thing every time in a particular manner. You don't want to disrupt that. And so in terms of proving efficacy, first there's initial intuition of physicians. Well, if they try it on and they say, wow, this would really have helped, and they go into another case and they're thinking, the whole time I was wishing I had your system because it would have really helped in that particular scenario. So that's sort of soft evidence that there's efficacy. But the real gold standard is to have a clinical trial, randomized clinical trial, to actually show improvement in the outcomes that matter. So for us, we're measuring contrast, radiation, procedure time, and eventually success rate and complications.
The randomized clinical trials are the gold standard in academic medicine of how you go about proving whether something works or not. It can be very costly and a long, drawn-out process, like you mentioned. Building medical evidence, it's difficult.
Yes.
And it consumes a lot of capital, and it consumes a lot of time, and it's sometimes frustrating, like you say. So I agree to all those comments. In terms of when you bring a new technology to the medical world, oftentimes you meet a lot of resistance, and how you were able to break down those barriers to get it into the clinical practice is sometimes I found it very challenging for us. I was wondering whether we could share a little bit about what enabled you to get into the actual clinical practice and get your technology tested.
I think it really is, there are certain audiences in medicine that are very gadget-oriented, and it's always helpful to be working in one of those spaces. But we often find ourselves, instead of pursuing surgeons and such, we do a lot of work on the nursing side and that side of healthcare. And I was having a discussion with someone earlier, and they said, well, surgeon, you can have a system, you can sell it for $1 million. And, yeah, I could sell to X number of surgeons, only so many in the country, but in a given institution, I can deal with tens of thousands of nurses. And the scale that these things take place, and when you talk about having an impact at scale, that if I can have a productivity improvement or quality of care improvement that can be delivered from that level, we can hit such a big audience. And I find that that's much easier to justify, because you have, when they look at the cost of those resources, the cost of time, the amount of time that a nurse spends doing data entry on a per patient basis is mind-blowing during the course of the day. But if we can take those types of steps, there's very quickly financial justification for it. Those particular that kind of user community in a healthcare institution is eager for process improvement because they live with it, versus activities that take place, a couple times a day in an institution. You're dealing with activities that take place hundreds and thousands of times per day.
Just to add to that, one thing that we've had success with is sort of targeting opinion leaders in certain fields. So we're fortunate to be at Columbia, where we have a number of physicians who are sort of thought leaders in their respective fields. So getting them on your side has been really powerful in our case.
And for us too, I agree with both of you. We have to recognize that we oftentimes think clinicians as the end user, but also there's so many different players in healthcare and different stakeholders that outnumber the number of physicians. And also having being able to connect with opinion leaders and thought leaders is key, because you get their vantage point of what they think about the field and how your technology may be able to add value to what they do. All right, thanks. Thank you, everyone.
Thank you very much.